Hi, welcome to OB Gym. I am so glad that you're here and that you found us. I wanted to just give you a quick introduction into what we're all about. Hi, I am Lisa Van Weel and I am the founder of OB Gym. I am a licensed physical therapist in both Iowa and Illinois. I attended the University of Iowa for my bachelor's in health and human physiology, and then went on to St. Ambrose University for my doctorate in physical therapy. I now hold an adjunct position at St. Ambrose where I'm teaching wound care, and this year only, I am teaching cardiopulmonary. And I am now returning to the University of Iowa for a PhD in human physiology, focusing specifically on pregnancy, postpartum, and the pelvic floor. I got into pelvic floor physical therapy after a very high-risk pregnancy, complicated and bad birth experience, and my own personal recovery from diastasis recti, postpartum PTSD, and also a grade 4 episiotomy. So I have personal experience with all this. I really believe in all this, and I am coming to you as a mother who could have used more support in the postpartum, and I am hoping to be that for you. So I am so excited that you've chosen to come on this journey with me, and I hope that I can give you a little bit more info about the pelvic floor and how to better advocate for yourself and when to seek out a pelvic floor physical therapist. So today we're going to talk a little bit about common pelvic floor disorders and things that we can do in pregnancy and postpartum to support our pelvic floors, as well as what OB Gym offers. I'd like to first start with basic anatomy and do a review of that. So looking at the bony pelvis, we have a few different things to keep our eyes on. The first piece that I want to call your attention to is the pubic symphysis. That's a common source of pain during pregnancy and the postpartum period, largely due to fluctuations in hormones, different positions, and then just some postural changes as well. Then we'll look at the ischial spine, and that just helps you kind of understand where we are in the anatomy. So those are the two wings of the pelvis, which make up your typical hip bones, what we measure when we're looking at dress fittings or things like that. And then we have our acetabulum, and that's where your femur communicates with the pelvis and how they attach together. We also have our ischial tuberosities, and those are commonly referred to as your sit bones, so it's not uncommon to have some pain there either. Here we can see the more external layer of pelvic floor musculature, different tendons, the perineum, as well as their attachments to both the vagina and anus. So this gives you a better understanding overall of how complex the pelvic floor is, what kind of supports that you have, and then all the different kinds of things that we can look at when we're looking at pelvic floor physical therapy. I won't go too far into it here because this is really a big portion of what we do in pelvic floor physical therapy is educating our patients, making sure that everybody is comfortable with their own anatomy and with knowledge that applies to them. So this is just a really good overview picture. Again, we won't go too into depth here. And then here we have an overview of the female reproductive system as it relates to other systems in our body. So you can see the uterus, the vagina, bladder, urethral canal. We have the anus and rectum as they attach to the intestines. And it's a really good cross-section view to understand what all the pelvic floor is holding up. This is a good one to review also when we look at prolapse and the different kinds of prolapse that we can have and understand how the anatomy is coming through there. Again, we're not going to go too into depth here, but this provides you a good basic understanding of female anatomy. This image gives us a good understanding of what the female reproductive system and the pelvic floor looks like during pregnancy. Obviously, organs have shifted, the uterus has become quite large, and the bladder has become more forward and it's gotten pressure from the uterus. So all of these things impact our pelvic floor and the way that our bodies are able to handle the forces put upon the pelvic floor. Again, we'll go into more detail and depth if you come to pelvic floor physical therapy, and we'll talk through things as they pertain to you specifically. This is another good overview of what we might be considering when we see you in the clinic. So some typical changes that we might see in pregnancy. Obviously, our pelvic floor has had an increase in abdominal pressure. There's a lot more weight coming through that the pelvic floor needs to support. We also have increased release of the hormones relaxin and elastin that increase our ligamentous flexibility and allow us to grow a baby, but they also allow us to have a little bit more wiggle room with our ligaments. And so sometimes our joints can use some extra reinforcements to maintain stability. This is something that we can focus on in pelvic floor physical therapy, even during pregnancy, and then after, as we're adjusting back to kind of regaining our normal anatomy and our normal postures. So this is a really good one to consider if you're having some kind of pain, if you're feeling a little bit unstable. This is a great time to see a pelvic floor physical therapist because there are changes going on and your joints might need to be trained to have a little bit more support. We do also see that there's a change in the angle between your bladder and urethra, and this can cause differences in urinary frequency, urinary urgency, and all those types of things. So while we see that incontinence is not uncommon during pregnancy or the postpartum period, there are things that we can do to help this and to address this. Incontinence is never normal, even if it is common. And we can talk through ways later on how to support a healthy pelvic floor during pregnancy. Now let's look at birth as something that could potentially affect the pelvic floor. And of course it can. This is a big event for many people, sort of a marathon, if you will. And in birth, there's definitely some pressures. There's some forces put through the pelvic floor that we just aren't used to and we probably haven't encountered before. So to start with, kind of one of the obvious and common ones is tearing or episiotomy. So depending on the grade, tearing and episiotomy can be just a small flesh wound that typically will heal with a stitch. And then we can progress all the way to perineal involvement, anal sphincter involvement, and the involvement of the anus itself. And so obviously as our grades increase, the complications with the pelvic floor increase. But certainly anybody that's had trauma to this area would be appropriate for pelvic floor physical therapy. We can do some scar massage, we can do some mobilization. There are ways to retrain your muscles after an injury like this, to coordinate them, to work in the ways that you want them to. So I would say if anybody's experienced tearing or episiotomy, certainly grade 2 or greater, I would seek out some pelvic floor physical therapy. Then moving on to C-section, keeping with our incision theme, C-section is obviously very traumatic to the mother. That's a major abdominal surgery. There are layers of tissue, muscle, skin. There could be bladder involvement. Definitely the uterus has been involved. So that's a lot to kind of recover from. And most mothers with C-sections could use a little bit of extra guidance to make sure that they're returning to their full abilities. We also could see after intense pushing or, perhaps several hours of pushing that mothers may develop prolapse, which is when the pelvic floor, the pelvic organs slide down through the vagina because the pelvic floor muscles have just not been able to withstand that force put down through them. So the vagina, rectum, or bladder could come through the vagina. And then with certain conditions, we can see even the vagina slipping through the vaginal canal. So these are things that we can see. They're fairly common to see in pelvic floor physical therapy. Again, though, it's never a normal thing to have these symptoms. So please seek out a physical therapist if you've had any of these birth complications. We have touched on some of these disorders and dysfunctions already in this talk, but we'll continue to go more into depth on common pelvic floor dysfunction, common pelvic floor disorders, and potential ways that we can treat them or signs and symptoms so that you know when to come into pelvic floor physical therapy or when to tell your mom friends that it's time for them to get checked out. One of the most common pelvic floor dysfunctions, and one that is seen in up to 100% of women by their third trimester of pregnancy, is diastasis recti abdominis. And that is basically just the separation of your abdominal muscles as we make room for baby, rapid weight gain, all these other kinds of influences. So what happens is the two sides of our six-pack, there's a line of fascia through the middle called linea alba, which connects the two sides of your six-pack. During pregnancy, there's a huge increase in outward pressure. As baby grows, uterus grows, those pelvic organs, all the abdominal organs are shifting. And this creates pressure on that linea alba and allows it to separate, and the linea alba thins. in that area where there's a thinning of the abdominal wall and no muscles to protect the inner abdominal organs is called your diastasis recti. Typically, we'll clinically diagnose this when the separation between your abdominal muscles is 2 finger widths or more. And then we also look at how well you're able to manage pressures along that linea alba. So if you experience coning or doming or, signs of herniation through that linea alba, that's when we become clinically concerned with a diastasis recti. So again, like I said, this is incredibly common. Up to 100% of women in studies have been estimated to experience diastasis recti by their 3rd trimester simply because of the way the anatomy works. And so the impact that this has on your fitness is that traditional core exercises become contraindicated because they're creating more abdominal pressure and they're actually pulling on that 6-pack and they're pulling your abdominals apart even more. So think of a traditional crunch. When you're coming up, you're crunching, you're really putting a lot of pressure down through the top of your abdomen. And where's that pressure going to go? It's going to go to the point of least resistance. So that's going to come out through the linea alba and actually weaken your abdominal system and potentially cause more issues with herniation and things like that. So we need to refocus our efforts. We can still strengthen our cores. There are many diastasis-friendly exercises that we can do, such as dead bugs. We can modify planks. We can do Pallof presses. There's so many great options, and unfortunately every Instagram trainer, YouTube trainer, they aren't trained in this. So this is something that you really need to be seeking out a pelvic floor physical therapist or specifically pregnancy and postpartum trained personal trainer to work you through this. So these are things, the diastasis will typically heal on its own to some degree, but we can definitely support this through our fitness. However, we can definitely worsen it through our fitness. So this is one topic that I love to talk about because I think there's a lot of mixed information out there, and I love to be a source of good information on this because this is something that's definitely affecting almost every mother in our country. So stay tuned. There will be lots more information about DRA coming your way via Instagram, YouTube, and different exercise programs I will be putting out. Another common pelvic floor disorder that we have touched on in this talk already is pelvic organ prolapse. And this is when either the bladder, vagina, uterus, or rectum falls through the vaginal canal. And this can be due to a lack of proper support from your pelvic floor muscles. So it doesn't mean that you are weak, that your pelvic floor is weak, that you are inherently damaged or unable to return to exercise. It just means that your pelvic floor is having a hard time keeping up with the demand placed upon it. So as a disclaimer, pelvic floor physical therapy will not place your organ back into the proper position in your body. What pelvic floor physical therapy does for pelvic organ prolapse is retrain your pelvic floor to properly support those organs and potentially reduce or eliminate the symptoms of pelvic floor dysfunction and pelvic organ prolapse. So common signs and symptoms of pelvic organ prolapse are feelings of heaviness, achiness, weight in your vagina, or even your lower pelvis. Also feelings that something might fall out, especially as you're continuing to do some functional tasks. That feeling that you might lose everything through your vagina is a really, really good sign of pelvic organ prolapse. Another sign that we see, and that can be determined on internal examination with a pelvic floor physical therapist, is seeing a bulge or seeing an organ present in the vaginal canal or even coming down through the vulva. And so we can work together to determine the extent of your pelvic organ prolapse and determine ways in which to reduce your symptoms. So some things that can contribute to pelvic organ prolapse is anything that puts a ton of abdominal pressure down through your pelvic floor. So this can be doing excessive amounts of crunches, especially, if you have a diastasis and you can't manage your pressures properly, the breakdown is going to occur somewhere. So it's not uncommon for it to occur through the linea alba, and that's typically what we'll see, but we might be seeing that you're just really bearing down, you're really trying to manage that pressure, and it's going out through the pelvic floor. Your pelvic floor is not responding well to that pressure, and we have a pelvic organ prolapse. Other ways that we can see this is people who are chronically constipated, who might be bearing down frequently and really, really just kind of giving it all they got. So some ways to combat that is to use a squatty potty, and that puts you in a better position for bowel movements, and it helps reduce that bearing down. We might also look at your fiber intake, your hydration status, and just really kind of getting in to see what is causing your constipation and how we can help that. And then other things are lifting very, very heavy weights. And so I use caution when I say that, because I don't want you to think that you can't continue to participate in your active lifestyle and that you can't continue to participate in CrossFit at the level that you have been before. What I want you to consider is that if you have a pelvic organ prolapse, this is your body's way of telling you that it is not withstanding the pressure that you're putting through it. And so we might need to approach your training a little bit differently for a while. We might need to back off on the weights for a while and work on some of our other core lifts. We might need to do some extra resistance training in muscle groups that can apply to the same lifts that you're doing, but that can take some pressure off the pelvic floor and allow us to really train up those muscles. We can also work on breathing techniques, because many people tend to use that Valsalva maneuver, the closed glottis, no breath, to get the really heavy weights up. So what we can consider is working on breath work and allowing our bodies and our pelvic floors to naturally kind of use the pressure as they're supposed to be. So there's lots of different options with this. I don't want you to think I'm telling you can't be active with pelvic organ prolapse. You definitely can. There are definitely ways to return to normal activities and everything that you were doing before. This is one where I would definitely seek out a pelvic floor physical therapist and seek out their guidance before considering more extreme options like surgery, the implantation of bladder mesh, and all those kinds of things, because pelvic floor physical therapy has been shown to be very effective in reducing symptoms and improving quality of life. Incontinence is one of the main reasons that many people seek out pelvic floor physical therapy. So there's two main types of incontinence. One is stress incontinence, which occurs with stress. So think of a heavy load and extreme force being placed on the body. Examples might include sneezing, again, lifting a heavy weight, having to react suddenly to an external force. These are all things that might cause some incontinence and could lead to stress incontinence. Again, while your doctor may tell you that it is common for people to have incontinence after pregnancy or incontinence with heavy lifting, common does not necessarily mean normal. It is never normal to be peeing your pants as an adult. So please don't let this be dismissed. Please seek out a pelvic floor physical therapist to address this concern. Another type of incontinence is urge incontinence. So this occurs when you have a trigger, you see that trigger, and then suddenly you need to pee, and you can't wait until you get to the bathroom to do it. So this might be, for some people, you get to your front door and you get your keys out and put the keys in the lock. As soon as your keys are in the lock, you feel the uncontrollable urge to urinate. That's urge incontinence. It's associated with a trigger. Now, it's possible to have both stress and urge incontinence as a mixed incontinence, and that's common as well. So there's a little bit of pelvic floor dysfunction. There's a little bit of different etiologies in this, but regardless, there's pelvic floor dysfunction that's leading to incontinence. So mixed incontinence is very, very common, and it's something that we can kind of work together to piece out how to fix and how to address this issue. I do also want to mention, especially for males that might be watching this video, that fecal incontinence occurs as well, especially in, people that are lifting heavy, that are participating in CrossFit and are, athletically participating at a very high level. So men typically will have a lower incidence of urinary incontinence because of their anatomy and the angle of their bladder and urethra, but it might not be uncommon that they experience some bowel incontinence. So if this is you, if you've got some skid marks in your underwear after lifting, you feel like you really have to kind of like pinch it shut to keep everything inside, it would be a good idea to seek out a pelvic floor physical therapist. Even if you've never been pregnant, even if you don't identify as a woman, there are still issues that can be worked on. So looking at perineal injury through tearing or episiotomy, this can occur during birth. We're seeing definitely damage to the pelvic floor. In these cases, there's a direct indefinite injury to pelvic floor musculature, the perineum itself, which holds a lot of ligamentous support and provides attachment sites for many pelvic floor muscles, the anal sphincter, which controls our bowel habits, and the anus itself. So with these tears and cuts, it isn't uncommon to see some urinary or stool incontinence. It isn't uncommon to see some prolapse because we have damaged our pelvic floor muscles. It isn't uncommon to see painful sex because we're dealing with scar tissue or we're dealing with a sensitive tissue now. So all of these issues can play a huge role in our functions as humans, as wives, as women, as mothers. You name it, this can affect it. So we might look at some scar management techniques. We might look at pain reduction techniques. It isn't uncommon after an injury like this to have some overactive pelvic floor muscles because your muscle has been injured, it's guarding itself, it's holding itself kind of tight to avoid any kind of re-injury. And so we can develop trigger points in our pelvic floor just like any other muscle. And especially after this kind of direct and intense injury, that's not uncommon. And oftentimes our physicians who aren't trained in pelvic floor rehab, they're trained in birthing babies, will give you this advice, oh, just do a Kegel and it'll be okay. And this is one instance in which it really might not be okay to continue doing these Kegels. You don't need to overtrain an overactive muscle. And so this is some time in some cases when seeking out a pelvic floor physical therapist might be really beneficial, because obviously we talk about tearing a lot. It's a joke in a lot of movies. It's a punchline for a lot of things, but it's really not funny. It's really pretty traumatic, and it's really damaging to your pelvic floor. And so I don't want this to be overlooked. This is definitely a reason to see a pelvic floor physical therapist, even if it's just for a check-in every couple months to make sure that the scar is healing the way it should, to make sure that your muscles are coordinated and training the way that they should be, and that you are allowed to participate in anything that you want to. C-section is another topic I love to talk about. Although I personally haven't experienced a C-section, I can vouch for the fact that it is a very intense abdominal surgery. So there's a lot to rehab there. We can look at scar tissue healing. We can look at desensitization of the skin after such an incredibly challenging surgery. But like I said before, we also cut through abdominal muscles. We've also experienced that diastasis recti abdominis if we're in the third trimester. And we haven't been spared from added pressure to our pelvic floors. So we've still endured a pregnancy or what have you that puts a ton of pressure down through the pelvic floor. So we could be experiencing incontinence. We could be experiencing prolapse even if we didn't birth vaginally. So please don't dismiss a C-section as somebody that does not need a pelvic floor physical therapist. They absolutely do, and perhaps even more so than somebody that's given birth vaginally because their sources of injury are greater. So here we can look at rehabbing our abdominals. We can look at diastasis-friendly options that are also C-section friendly. We can look at carrying patterns. We can look at ways to go up and down the stairs after an intense abdominal surgery. There's so many things that we can look at with C-sections that it's hard to get into it with just this one little slide. So again, stay tuned for further topics on Instagram, on YouTube, on my website for C-sections. But please, if there's one takeaway from this slide, don't believe that people with C-sections were spared from pelvic floor trauma. Anybody that's been pregnant has endured some added pressure and added stress to our pelvic floors. So if you've had a C-section, you are definitely worthy of some pelvic floor physical therapy. Many women also experience pelvic pain, which can be chronic and caused by nerve disorders and muscular imbalances, so many different things that can cause pelvic pain. And then dyspareunia, which is painful intercourse. But I like to kind of generalize that out into any kind of painful penetration. So that can be through intercourse. It can be through masturbation. It can be through insertion of a tampon, pap smears, vaginal exams. If any of those things are extremely painful to you or uncomfortable, or those are prohibitive to you because of pain, these are all things that can be addressed with pelvic floor physical therapy and should be addressed by pelvic floor physical therapy. So if you're experiencing any of these things, please do come in and know that I don't think that this is a small thing. If you're unable to participate in intimacy with your husband or any partner, that definitely puts a strain on the relationship, and it can put a huge strain on you personally as well if you don't have that way to connect with others or yourself. That's a big issue to me. And if you are not able to insert a tampon, and then you don't want to exercise because you don't want to deal with pads sliding all around, that's a barrier for you. That's something I want to address. And definitely, if you cannot tolerate a pap smear because of the use of the speculum, there are tools that we can use. There are things that we can do. We can make this better for you. You 100% need to be allowed to participate in your healthcare. And a pap smear is a hugely important healthcare tool. It's a hugely important evaluation. And I don't want you to have to skip it because you have pelvic pain. We can work on that. We can address those issues. There are so many things that we can try, and I want to help you through that. I want you to have full access to good health care. So please, please don't think that it's just a little bit of pain. It's nothing I can't handle. My doctor told me to have a glass of wine, whatever. That's not good enough. You deserve better. You deserve to be able to participate in whatever you want to, whatever is meaningful for you. If it's sex, if it's exams, if it's fitness, if it's inserting a tampon, whatever it is, you deserve to be able to do it. So please seek out some pelvic floor physical therapy. So that was a fast little overview of everything pelvic floor. Obviously, there's so many more things that we can get into, we will get into. Again, please continue to return here to my page. Please continue to check out my Instagram and my Facebook accounts, as well as my business website, www.theob/gym.com, where I'll be posting more educational content. We'll go into further detail on all of these things that we've talked about. And we can discuss, questions from my Instagram stories. We can dive into topics that are meaningful for you. I hope that this was a good overview of the pelvic floor and common dysfunction, common signs that you need to seek out some pelvic floor physical therapy. So I hope that was a great intro to you. And now I want to talk to you a little bit, just very briefly, about my business and what we do. So the OBGYM, the OB Gym, is a cash-based physical therapy service located in Moline, Illinois. So we are upstairs in the Movement, which is a CrossFit style gym. So you'll come in, you'll go upstairs to my office, and I offer lots of different services, which I'll talk about on our next slide. But I do want to kind of get into this idea of a cash-based physical therapy service. So I don't take any insurance. I am out of network for everyone. So this means that instead of a copay, you pay me directly. And so I don't communicate with your insurance company. I don't have to get approvals from them. It is really just therapy that is totally dependent on what you want to get out of it. And so that means that we can focus only on your goals. And we can continue seeing each other until your goals are met, not when the insurance company decides that they should be met and that they're not going to pay for it any further. And then it also means that you get to set your own frequency. So typically insurance companies like you to be seen 1 to 2 to 3 times a week for at least 6 weeks. And that's kind of the formula that PT is forced to follow because that's what insurance companies like to reimburse. With a cash-based system, I don't have to do that. So if you come to me and you say, I am so ready to get rid of my pelvic floor dysfunction, but here's the thing, I'm a mom of 4 and a working mother, and I do this and I do that and whatever it is, I only have time to see you once every 2 weeks, and I can email you a check-in every other week, the weeks that I don't see you. So we can totally do that. I can see you every 2 weeks and we can have a little phone check-in or what have you, and fit your schedule and fit your lifestyle. Or if, the budget is such that you can only see me once a week, but you can do some exercise programming that I give you, we can do that too. We can have our monthly check-ins. I can provide you with an exercise program that you can follow. You can apply what you learn in physical therapy with me to exercise. You can get started on something that's meaningful for you, and we can fit your budget. We can accommodate your needs. And that's really, really important to me, that the service that I provide you is all about you. It isn't about the insurance company telling me what they will and won't pay for. You and I have decided what you need and what you can pay for. And so that's important to me, that you know that I'm not just out here trying to grab your cash and get as much as I can. I'm actually going to be getting paid a lot less doing it this way, and the reimbursement is going to be a lot less. But I don't need to pay the insurance company. I don't need to pay a hospital system. I don't need to pay all these extra things. We're just doing what works for us. And so that is why it's a cash-based physical therapy system. It's not, a money scheme. It's really because I want the freedom to treat you and your needs. However, the caveat to that is, and it's a super big bummer, is that Medicare and Medicaid recipients cannot be seen by me, because Medicare and Medicaid do not allow for out-of-network providers. So I'm not allowed to opt out of Medicare and Medicaid. So I cannot see you for physical therapy. However, you are able to purchase any of my education materials. You're able to come to my information sessions. You can purchase exercise programming. We can do all of those things. I just cannot provide you one-on-one physical therapy service. So I am offering several different services through the OB Gym, and will continue to for as long as they are utilized. So obviously my big one, my main one that I'm really promoting is this pelvic floor physical therapy. And it's what I'm very passionate about. It is the why behind the service. However, I recognize that that's not something that everybody is interested in or that everybody can commit to. So I am offering other services that I hope will support mothers in other ways. So another service that I'm offering is postpartum screenings. So this is not pelvic floor physical therapy. It's a shorter appointment. It's a one-time appointment, and it can be done virtually or in my office. And I like to do this between 2 and 4 weeks postpartum, but it's really whatever works for you. But we set up a time, we get together via Skype, phone, whatever it is that works for you. You can come into my office and we talk about how things are going. And so if you have any signs or symptoms of pelvic floor dysfunction at that point, like you're having a hard time with your diastasis, you're having some pelvic pain, you're having some issues with that scar, perhaps your C-section scar is really sensitive, we can talk about solutions for that. We can game plan if you do want to come in for physical therapy, and then we can game plan a way for you to return to activity safely. And so that typically doesn't begin and end with a 6-week appointment with your physician that delivered your baby. They're great at what they do. They've been trained to deliver babies. They've been trained to get you safely through a pregnancy. They are not trained to rehab you, just like I am not trained to deliver your baby. So there should be somebody else checking in on you after that. There's somebody here just for you, just to make sure that you are getting what you need postpartum. So that's what the postpartum screen is all about. I also offer return to exercise programming in collaboration with the Movement Moms. So we offer 3 different tracks of training. You get 5 workouts per week, and there is, like I said, 3 tracks. So it can be done at the Movement, and it follows along with the Movement's regularly scheduled programming. So you can do that during class time without disrupting anyone else. You're still participating in the workout, just with options that are diastasis prolapse friendly. We also have an option or a track for Ultimate Fitness, which has locations in Rock Island and Bettendorf. And again, we only use equipment that's located there. It's not aligned with any other class. It just has scaled options for you to do 5 workouts per week with the equipment available at Ultimate Fitness. And then we have an at-home track. So we try to use minimal equipment, and typically only things that people would have. So maybe a pair of dumbbells, maybe a couple bands, and we can certainly link, our suggested ones for you. And then that way we still have options that can meet your needs, that meet your time frame. We offer 5 workouts a week, and you get to do them whenever they work for you and whatever environment works for you. So you can take that to your gym if you're far away and I don't have a gym track that works for you, you can do the at-home track and then scale it to whatever you have available at your gym as well. I also offer infant development screens. So I started originally working in pediatrics, and I was so passionate about it, but then I had my daughter and I said, I need some time with some adults. I cannot do this thing where I'm around kids all day long and I never get to speak to an adult. So I kind of phased out of pediatrics a little bit, but definitely love that world and love to have like little nuggets of it. So something that I've added that I think supports mothers as well is an infant development screen. And so our main focus through this screening is to check baby's head shape. It's very, very common that children will develop a looking preference where they only turn their head one direction, or a head shape dysfunction. And so that can occur for a number of different reasons. It's usually positional, can be related to some gut stuff, reflux, things like that. But if a baby does develop a head shape abnormality, that's something that we want to get in on early. We want to focus on early so that we can prevent any issues down the line. So I screen for that. I screen for any like gross abnormalities or delays in development that would merit another physician's referral. And the reason I offer this is because, again, physicians are not always trained to see these things the way that a physical therapist does. So I, as a physical therapist, as a pediatric physical therapist, had my daughter, and she did develop torticollis and head shape abnormality called plagiocephaly because of her severe reflux. And so positioning things didn't work. And I, kept taking her into the physician who I love. I love her doctor. And I would say, I'm concerned about her head shape. And I've tried everything that I know how to do. And I am a trained physical therapist. I work in pediatrics. This is something that I do. I've done everything I know how to do, and she is still holding her head in this position, probably because of the reflux. And I would like an appointment to go see a helmet specialist. And the physician continued to say, oh no, it's very, very mild. She doesn't need to go see that. We don't need to take that step. So finally I measured her myself, and she did have a severe plagiocephaly that did require a helmet. And so through my own advocacy, I was able to get that for my daughter, but that's something that so many people don't know. So I do want to offer that service of having these screens and having another check-in with somebody that's trained to do that so that we can catch these issues early on. And then we also offer our education courses. So these are something that I'm working on right now. I am adding them as we go along. So I'm not offering the subscription to that yet, but it will be coming. And I want you guys to keep your eyes peeled for that. And I'm trying to make it a very, very accessible price so that those Medicare and Medicaid recipients can utilize that service and have it be beneficial toward them. I don't want to create a barrier to education and allowing people to advocate better for themselves. So those are big things that I'm excited about. And then I am in a CrossFit gym, and I totally understand the importance of muscular recovery, enhancing our performance, all those kind of things. So I do offer recovery tools, which are cupping and gua sha in my clinic, and I am available for drop-in appointments for that. The Movement members, which is the gym I'm located in, do receive a $15 discount for those tools. And I do that just as a thank you for all the support that they've provided for me over the years. But those are all the services that I offer, and I hope to see you soon. And remember to check out my website, www.theobgym.com, my Instagram at the OB Gym, and my Facebook, the OB Gym. And I look forward to seeing you and interacting with you and continuing to put out content for you. If there's anything you want me to focus on more in these next videos, please feel free to comment, tag your friends, share this video with your friends, and make sure that I am delivering what you are interested in.